Go to Singapore and speak to Adam Hancock. Adam, the most significant changes, have we covered most of them?
Yes, certainly in terms of how people's lives will be impacted, then the requirement for testing and negative tests to enter certain venues like the public transport systems or parks or other outdoor spaces. The people no longer requiring negative tests to go into those areas will make a massive difference to people's lives, because we've seen people having to queue up for hours at these testing booths across China, waiting to get a negative result so they can update the app on their phone. They get a little green code, a little green pass, which allows them entry into these public areas. So that changing will make a big difference. But this isn't really being very streamlined at the moment. We're seeing it sporadically in different areas of China, different cities, different regions. There's no kind of nationwide policy on this at the moment, and it has caused some confusion. We're hearing reports in Beijing where the authorities are actually closing these testing centres, but people are still requiring tests to get into office buildings, for example, or malls. So the queues are getting longer at these testing centres because there's less of them, and they're also open for less hours. And I think officials are still a little bit cautious on exactly what the rules are. Obviously, the rules are changing very fast, but there's not one policy at the moment. The main policy remains COVID zero. So I don't think officials want to get anything too wrong and maybe are perhaps being a little overcautious. The other big change, which reportedly is going to be on the way and will be announced on a nationwide basis, is how close contacts and people who actually catch the virus are dealt with and treated moving forward. So at the moment, everyone who gets COVID is taken off to a central quarantine facility, but we understand that soon that could change, and there could be the option for people to quarantine at home, and also that could be the case for close contacts as well, and possibly redefining what a close contact means. Previously, if one person in an entire apartment block has tested positive, that whole compound has been locked down. But we understand that that could be changing at some point soon, and close contacts will be, as they sound, much closer contacts than what they've been categorized as so far.
Adam, from what you're saying, this sounds really, really interesting, given what happened in many other countries during the height of their pandemics, because the analysis was that if governments don't give very clear instructions, then it can become dangerous. And you're saying that it almost seems to be a moment of transition. While the Beijing government still wants to pursue zero COVID, some restrictions are being eased elsewhere. There is also the scientific analysis that possibly opening up too quickly in a country where cases are rising, and especially where the elderly are not vaccinated enough, that there could be an explosion of cases that becomes extremely dangerous for China.
Yeah, it's really a balancing act that the government are facing at the moment. They have got all of this scientific advice, as you said. On one hand, they're looking at vaccination rates among the elderly, which are very low compared to the general population. I'm sure they're also aware of some studies that have been performed on the vaccines that China are using and their relative performance against these new variants that have cropped up in recent years. But on the other hand, they understand the mass resources that COVID zero requires, the amount of testing, the economic damage that these continued lockdowns are doing. It's not just within China. Obviously, businesses are suffering there when they're in and out of lockdown, but also internationally as well. It's very difficult to do business with China at the moment. It's very difficult to enter the country. There's not a lot of confidence. And they see the rest of the world starting to pick themselves up after the pandemic and move on and return to some kind of normality, whereas China almost feels like it's been left behind at the moment. Factor in as well that these new variants are so difficult to contain. It's very, very hard to have a COVID zero policy when you're dealing with variants which are so transmissible, and the methods that work so effectively in the past just don't seem to be working anymore. And then you've got the third element, which is obviously public fatigue and public anger as well. Obviously, we saw those protests. We saw people out on the streets demanding freedom. Given the timing that these changes have come in, it does look like the government have listened to people and do understand their frustration. Even Xi Jinping apparently referenced it in a meeting with EU officials, saying that students were amongst the protesters because they were frustrated at 3 years of COVID. But remember, all of this is great in terms of if they want to open up and try and resume life, but they have to bear in mind that China never really saw that huge wave that many countries saw in the height of the pandemic. Lots of the population have never had the virus, and this, if they really open up, is going to rip through society. And it's a question of whether or not their health facilities can cope with, that sheer level of infections. And a lot of elderly people in China, a lot of elderly people unvaccinated, can they cope with reopening? That is the big question that the government must be grappling with at the moment.
Adam, as always, appreciate it. Adam Hancock in Singapore.